Prime Minister Mitchell calls on medical professionals in the diaspora to return to assist during this period. We'll have details to this story and more in the national report. With the details to the news for Tuesday, September 28th, I am Rikisha St. Louis. Prime Minister Dr. The Right Honorable Keith Mitchell is appealing to Grenadian doctors and other medical professionals abroad to return to give assistance to Grenada in its fight to battle the COVID-19 pandemic. Grenada's healthcare sector was severely impacted recently as the Ministry of Health recorded a significant number of positive cases among health personnel. On Tuesday, during the government's weekly post-cabinet press briefing, Dr. Mitchell said the country is in need at this time, which requires an adoption of an all-hands-on-deck approach to get through this difficult period. He's optimistic that the return of medical professionals in the diaspora will alleviate the stress and pressure felt by many currently working around the clock within the sector.
We've trained hundreds of doctors in this country. The country needs us. It makes sense, all of us. I have called on family members where there are nurses and so on. Come on, give her 2 weeks. We need you. Your country needs you. We need everybody to come at this time. The community centers need, facility clinics need all to be opened so that people can get the service when they need. The nursing staff is overstretched. They cannot man every facilities outside there. So the more we cooperate, the more we help them, help ourselves really, the better for us. I don't think we need more pleading to do what we have to do to protect ourselves.
2 young Grenadian medical professionals are among the growing list of those in the diaspora who are lending their professional expertise to Grenada as it continues to battle the COVID-19 pandemic. The visit by Dr. Molara Alexis and Dr. Karina David comes on the heels of last week's visit by Dr. Philip Bonaparte, who led a 3-person team to Grenada. Dr. Alexis, an infectious disease physician who has experienced a few COVID-19 surges in the U.S., says collaboration is key in curbing the further spread of the virus. She emphasized that there are many other Grenadians in the diaspora who are part of efforts to give support to the health sector.
Grenada is my home, and I wanted to be here to just support the healthcare workers during this very terrible time, to let them know that, you are not alone. We are here to support you however we can, and also to provide whatever support I can to the healthcare workers here in our beloved Grenada, Carriacou, and Petite Martinique. I do not speak on my own behalf, but also on the behalf of the other medical professionals in the diaspora. We have a group, and some of our objectives, briefly, I would be remiss if I did not mention these are the doctors and other healthcare professionals, laboratory professionals, and right now they are working on raising funds, on providing education, on providing telemedicine like backup support, and also as is possible to come to the ground to support the healthcare workers.
Primary care physician Dr. Karina David is grateful for the opportunity to serve her country during this time. She commended the diaspora healthcare team for investing in Grenada.
I have quite a bit of experience with how COVID affects a broad spectrum of patients, and I'm happy to answer any questions that we may have regarding that. And as Dr. Alexis mentioned, I have to thank the diaspora, the group of physicians who we have been working with, spearheaded by Dr. Michelle Friday, Dr. Lisa Radix. They have been instrumental in getting us here today. They are working tirelessly behind the scenes to provide as much support as possible, and it's really admirable what they're doing.
The doctors encouraged the members of the population who are hesitant about getting vaccinated to consider the option, as it is their best shot in preventing the further spread of the virus.
We saw a steady decline until we went down to just very few cases. And then here comes the Delta variant. But what I have personally seen with my eyes is that the patients I am admitting, or the patients that I have admitted to hospital, particularly those who are severely ill, are the ones who are unvaccinated. We do understand that there are breakthrough cases, and yes, I have seen, partially vaccinated people come to the hospital. But in the majority of cases, the people who are admitted, struggling to breathe, requiring a ventilator, going to the ICU are unvaccinated patients.
Our vaccinated patients just tend to do better. If you're vaccinated, God forbid you end up in the hospital, you just tend to have a shorter, easier course. We see a lot less ICU admissions, a lot less intubations. We know that our vaccinated population just tends to do better. It is, as Dr. Alexis said, the same thing that we are seeing here in Grenada. It just tends to be that the unvaccinated individuals just don't have great outcomes. It's quite disheartening to see, we have an answer to this pandemic. We have a potential cure to this pandemic. Often we hear individuals talk about, why would I get the vaccine if you can still get COVID if you get the vaccination? The purpose of this is to lessen the impact, lessen the economic impact, the public health impact. We want to see COVID be something more like the common cold. You get it, you get over it. It doesn't have to be a big thing.
Monday's COVID-19 dashboard from the Ministry of Health reveals an encouraging number of recoveries. 3,080 from a total of 5,005 confirmed cases. There are 83 new positive cases and 70 people are currently hospitalized. Continuing the news, the COVID-19 vaccine is safe for pregnant and breastfeeding women. That assurance from Grenadian volunteer Dr. Karina David. She said amidst the concerns about the safety of COVID-19 vaccines for women during pregnancy, it is quite safe and reduces severe illnesses during and after pregnancy. Dr. David said contracting the virus during pregnancy can increase the risk for severe illnesses and adverse maternal and neonatal outcomes.
We do recommend that pregnant women and lactating women get the vaccination. In fact, pregnant women, they stand to have higher rates of complication from COVID-19. And so yes, if you are pregnant, we implore you, go ahead and get the vaccine. It is safe, it is effective in pregnancy. In fact, your risk of complication from COVID is so much higher than your risk of complication from the vaccine. As it stands to nursing mothers, yes, we 100% recommend vaccinations in nursing mothers. In fact, I was nursing my 4-week-old infant when I got my first dose. He was about 12 weeks old when I got my second dose, and still nursing him. I got my booster last week, and he is still doing well. So I definitely recommend it to everybody.
Dr. Molara Alexis also joined with her colleagues, stressing that COVID-19 vaccination is safe among pregnant women.
People like to know, numbers. Again, the New England Journal of Medicine, they had an article where they looked at a little over 35,000 people who were pregnant who received the COVID vaccine, mRNA vaccine, of which Pfizer is one, and there were no safety signals, meaning they did not see anything that would indicate that the vaccine causes like abortions, spontaneous abortions, preterm labor, or something like that. There was another study done by St. George's University, not our St. George's University, but the one in London, United Kingdom, and they were able to say that after looking at the women who got these vaccines, the mRNA vaccines, particularly at a small percentage AstraZeneca, there was no increased rates, for example, of stillbirths and fetal abnormalities. So again, it is not a live vaccine. For example, the measles, mumps, rubella vaccine, that's a live vaccine. You're not going to give it to a pregnant woman. But these vaccines that we are offering here, the Pfizer and the AstraZeneca, they are not live vaccines. And thus, I agree that vaccination is safe in pregnancy and breastfeeding.
This is the National Report. The news will continue after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Welcome back. The government of Grenada, in agreement with the religious community and the funeral directors, has decided that all funerals, whether they are of people who have died from COVID-19 or other causes, will be held at the cemetery for no more than 1 hour and with no more than 20 people. In a statement issued on Tuesday, Reverend Silbert Prescott, chairman of the Conference of Churches in Grenada, said that decision was taken out of an abundance of caution, having been told that the possibility of the spread of the virus decreases in open spaces as opposed to indoor environments. The statement added that every time there is a funeral, regardless of whether or not the individual died from COVID or other non-infectious causes, the gathering of persons often in a heightened emotional state puts the funeral directors, clergy persons, and those attending the funeral at risk. Last week, a joint statement was issued by the government, the religious community, and the funeral directors, outlining a number of decisions to help prevent the spread of the virus. Among the decisions taken was that all burials from deaths due to COVID-19 will be done within 72 hours from the time of the certification of death. It was also decided that those who have died from COVID-19 will not be embalmed. Continuing the news, visiting Grenadian Dr. Molara Alexis warns against complacency as the country begins to record a decline in positive COVID-19 cases. In recent weeks, the Ministry of Health has been steadily recording positive cases above 100 daily. However, in recent days, confirmed positive cases were below 100, with 63 cases recorded on September 25th, 93 on September 26th, and 83 on September 27th. Dr. Alexis warned now is not the time to let our guards down, but to continue the island-wide vaccination program. She cautioned that becoming complacent only exposes Grenada to another wave of positive cases.
When we see that, this is more reason for us to keep doing what we're doing, because the virus that causes COVID-19, because it can cause variants, we don't want to say, well, okay, we are getting through, things are getting better, so we don't need to get vaccinated and so forth. No, now is the time to even ramp up our agenda in getting vaccinated, because sometimes down the road we can have another variant, and if we are vaccinated, that increases our chance of being protected. So although the rates, we are seeing a decline, and we hope we are going down the mountain, continually down the mountain, now is the time to continue the vaccination drive, because down the road we may have another variant, and this vaccine would help protect us from the Delta and hopefully from other variants in the future.
To date, more than 34,000 Grenadians have received the first dose of vaccine, and over 23,000 are fully vaccinated. Finally, in the news, Minister for Education, Human Resource Development, Religious Affairs and Information, Honorable Emmeline Pear, extends profound gratitude to all stakeholders, spiritual leaders, the media, organizations and individuals who coordinated, facilitated and contributed to the National Days of Spiritual Reflection and Prayer. It was held during the weekend of September 25th to September 26th under the theme, A Call to Return to God. Minister Pear is pleased that the nation was given intentional moments to connect with God and be renewed through fervent prayer from faith leaders and ministers of religion, and to be uplifted by the praise and worship teams that participated in the much-needed spiritual activity. She feels encouraged by the participation of the viewing and listening public at home and in the diaspora. The Religious Affairs Minister believes more of this type of community worship is needed, particularly at this time as Grenada moves through a difficult period sparked by the current COVID-19 crisis. She encourages Grenadians to continue to trust God and look to Him for a complete healing of the nation, knowing that God is able. The minister also hinted that government will look into making this an annual activity. That story just ended the national report for Tuesday, September 28th, recapping the top story. Prime Minister Mitchell calls on medical professionals in the diaspora to return to assist during this period. On behalf of the entire news and production team, I am Rikisha St. Louis saying thank you for joining us. Until next time.